Hey everybody, just wanted to follow up, keep everyone posted on the developments. I am day 42 in dealing with Bell's palsy. It's been quite a challenge, and just wanted to give a status report, give a little sit rep, let everybody know what the developments are and the progress. And I certainly appreciate all the words of encouragement that everyone has been sending me, and really do appreciate you taking your time to express your thoughts and concerns. So, like I said, I'm 42 days into dealing with Bell's palsy, and uh, as of today, there is some slight, little bit more of recovery. When I try to, let me take my glasses off. When you raise your eyebrows, um, this, of course, this is the unaffected side. The left side is the one that's affected with this nerve damage. And the funny thing is to watch my eyes when I blink. I've never been able to have my eye. People do crazy things to have their eyes do this kind of stuff. But anyway, it's kind of crazy. But anyway, there's a little bit more. If you notice this side versus the affected side, I have a little bit more range of movement. It might be ever so slight in the whole side of the face, which is good. That's an improvement. The cheek area that's affected, of course, you bite your tongue, your cheek, your lips all the time because you just don't have the control of the facial muscles and nerves like you used to. And so the things that I've learned is just simply how to do your best to overcome it, deal with it. Like the doctor said, suck it up and move on, as difficult as that may be. But anyway, when you try to smile, it's funny. You do all these exercises throughout the day, driving in the car, do whatever. You're in the office doing your stuff, or you're on the range, tapping out a few rounds, trying to throw some rounds down range, and your vision is just isn't right. But anyway, you do your best, and there are still some issues on syllables, pronouncing words and syllables that I still have issues. Still don't have that complete full range of movement, but there is some improvements. I'll use the straw here as like a little pointer. When you smile, you'll see that I have a little bit more movement in the cheek area. You look at this versus one of my first one or two videos, and there is some improvement. The neck, it's still a little sensitive in here, but primarily only pressure sensitive. It doesn't have the shards of pain shooting across the front part of the face or the back of the skull. I don't have that anymore. I'm able to sleep pretty much normal now. Don't have to have the arm propped up even on a pillow. Don't have to have that anymore. That seemed to last only about 2 weeks, give or take a day or so. Last time we met, we talked about a survival kit of things that you need in the event that you or a family member, or hopefully not a child, may wake up one day and have this. And obviously, you'll always need a bunch of straws. Have to have them, need them. And the reason for that is so that not only do you keep all your fluids inside your mouth and keep that mess to a minimum, but also because if you work the straw across the mouth, it also helps you to work the affected side of the face. So in a sense, it's kind of training or therapy of some sort. It also allows you to work the throat. You might get a a thick drink, perhaps a milkshake or frosty or something other than just straight liquid. And that helps you to exercise the muscles and all the facial muscles in here. Uh, you just have to keep them exercised. Another thing you have to have, of course, is your eye drops. You need those, and you can pick them up, of course, at any drugstore because most likely when you sleep, your eye is going to become a bit dry, and it's going to take it a good hour or so in the morning to get it cleared, or depending on what shift you're on, or whatever the environment is that you're doing. Another funny thing is the eye patch. I produced this last time, and it had some funny remarks. Folks I know, they thought I was holding up a condom, a prophylactic, thinking that I was using that to cover their eye, and that's not the case. This is purely, let me hold it up so you can see it. This is purely a generic over-the-counter eye patch that you can get at any drugstore. And not only do you need them in your basic first aid, but you also need them to help keep the eyelid closed at night so that it doesn't become dry and irritated, because it is going to take a little while to get it cleared. Some other things that I've used, and I have pretty good luck too with a standard Band-Aid. In the event that I choose not to use an eye patch and an additional napkin, I use the standard Band-Aid to simply put on the eyelid, pull it kind of tight, and then attach the other end to the cheek to help keep the eyelid closed. And of course, you'll always need some additional medical tape. Keep that on handy to help keep all this stuff in place. Don't forget about your napkins. You need a bunch of these. Keep them in your pocket. Keep them everywhere you are, because you're going to spill stuff. And in the event that you always keep a drink handy, make sure it has a lid and a straw. You need those two things, especially if you're dealing with Bell's palsy, because you're going to have some issues. It's going to cause some problems. But anyway, not much I can tell you. You can still see how the unaffected eyebrow is a little higher than the other. Trying to smile, the affected side is just not happening. And of course, eating and brushing your teeth is still a problem. The eating issue is that you'll occasionally bite the inner parts of your mouth, and is getting food or stuff over to the unaffected side, because once it gets over to the affected side down in here in the cheek area, it's really kind of tough to get it out, because no matter what you do, you either got to stick your finger all in there. Your tongue just isn't, it just doesn't work as well, and it certainly makes you appreciate the efforts that other folks have gone through, and certainly helps you to understand, even when you look at a stroke patient of any age, when you see the challenges that they've had to overcome, it makes you appreciate what you have, and learn the old saying, count your blessings every day. Anyway, that's an update. Like I said, I'm day 42 into Bell's palsy, and hope for the best. That's all I can do. Most of the swelling that's over here has gone down. Some people say it has. I don't know if it's fat or if it's just swelling, but I don't think it's as bad as it once was. Anyway, other than that, do your best, and we'll try to move forward to another day. As always, see you later.